Hello everyone, this is the week 6 discussion, health policy in the news number 2. So the news source I used for my policy is the U.S. Department of Health and Human Services website. It falls in the top middle of the media bias chart, so it is highly factual and mostly unbiased. It's in the middle of the chart. So the policy that I chose to discuss today is the SMD 23-003, otherwise known as the Opportunities to Test Transition-Related Strategies to Support Community Reentry and Improve Care Transitions for individuals who are incarcerated. It was passed by the federal government and is now in the legislative branch of the government for the states to see how each individual state can enact this policy. So the first point that I thought was important about this policy in this article was that before the policy there was a healthcare gap where those released from prison had an amount of time where they weren't covered by insurance and they couldn't get the healthcare that they needed. The second point is that in the article that Illinois, Kentucky, Oregon, Utah, and Vermont have been authorized by the U.S. Department of Health and Human Services to act on SMD 23-003 and provide healthcare coverage to incarcerated people prior to release. So this is really just to cover the gap, because before you were released from prison and you didn't have any healthcare coverage, but now to kind of fix this issue they are giving you the coverage before you're released, so it's kind of covering that gap. And the third point is that this was done, like I said, to provide better transition into the community for the former prisoners. It's one less thing that they have to deal with when re-entering society. So this is important because the quality of health care for those who were previously incarcerated has been historically overlooked. Before this policy, prisoners who have been released have waited months or years to get the health care coverage that they need, and some end up not receiving any. A lot of them struggle with chronic health issues, behavioral health issues, or addiction, so not receiving this care is a public health concern, because regardless if they're prisoners or not, however you feel about them, they still are people, and it is a public health concern when people cannot get the care that they need. And another thing is, like, not all people have family that can help them when they get out of prison, that can pay for the medical visits, things like that. So this policy really helps get that established while they are in prison, and then when they get out they already have their insurance covered, they already have everything they need to get the health care that they deserve when they get out. It really, like I said, just helps their transition back into society. So how can I use this information? I can use this information to stay informed on how this policy will impact my state. I can watch the news and see when we are able to vote on how it will be enacted in my area, maybe my parish, and I can use my right to vote for things to help prisoners re-enter society. So thank you.